is Shauna. Today I'm going to be doing a few tests and exams for the musculoskeletal exams. A couple of tests for the hands, shoulders, wrists, and knees. Can you tell me your name while I wash my hands?
Ray Jackson,
And your birthday?
5/18/90.
Are you having any pain anywhere today?
No.
All right. The first test I'm going to do, I'm going to be looking at her hands and wrists. I'm going to be seeing if she has, checking to see if she has what we call a navicular fracture. I'm going to take the patient's hand. I'm going to have her extend her thumb. I'm going to find the anatomical snuff box, which is this little notch right here. It's kind of a little groove. I'm going to press it for approximately 30 seconds. And if she's having any pain or discomfort, that could be the signs of a navicular fracture. The pain is because there's minimal blood flow to that area, and necrosis could occur in that type of fracture because it's slow healing because of the decreased blood flow to that area. The next thing I'm going to do is do a couple of tests for carpal tunnel syndrome. I'm going to take her hand and I'm going to percuss over the nerve of the median nerve of the carpal tunnel, and I'm just going to percuss it. And if she has any pain, that could be indicative of carpal tunnel syndrome. Tunnel sign. Next, I'm going to do what's called the Fallon's test, where I'm going to have her put her hand in the prayer position like this, and ask her to press her wrists together for about 30 seconds. Are you having any pain?
No.
If there was pain there, that's another sign that she possibly could have carpal tunnel syndrome. The next is the median compression test, where I'm going to take her hand and I'm just going to press on that median nerve over the carpal tunnel, and I'm just going to press it for, again, 30 seconds. Any pain?
No.
If she had any pain or numbness, again, over in the hand,
No.
that could be indicative of carpal tunnel syndrome as well. Next test, I'm going to test for decavenous tenosynovitis, which basically is just testing to see if there's any inflammation of the tendons. First test is the Finkelstein test, where I'm going to have the patient make a fist, tuck her thumb inside the fist, and I'm just going to extend the wrist. Again, for about 30 seconds. Any pain? And if she had any pain there, that could be indicative of inflammation of that tendon, or decoverine, I can't say it, tenosynovitis, I think it's called. Next, I'm going to test the vascular blood flow of the hand. I'm going to have her make a fist. I'm going to occlude the radial and ulnar arteries, have her open the hand, and her hand should be white. I'm going to release one of the arteries, and her hand should begin to pink up. I'm going to have her make a fist again, compress both arteries, release the other side. First of all, before releasing, have her open her fist. Her inside of her hand will be white. Release the other artery, and her hand again should pink up. Again, this is testing for vascular sufficiency in the hand. We would check that before we access that artery for an ABG, arterial blood gas, or before we were to insert an arterial line. Next, I'm going to have the patient stand up. This test I missed on the previous video. It's internal and external rotation of range of motion for the shoulder. So I'm going to have her with one of her hands reach back and scratch her neck. That's internal rotation. And then with that same hand, I'm going to have her release, put her hand back down, and then reach behind her and touch the opposite scapula. And we would of course check both sides. We'll just do one side for today. And that's just range of motion of the shoulder, internal and external rotation, which I missed on the previous video. Next, we're going to do some tests where we're going to do some tests to see if we suspect any injury or pain to the shoulder or the rotator cuff. The first test is the speeds test, where I'll have her raise her arms in front of her, palms up. Excuse me. I'm going to press down while she resists me. Do you have any pain in
No.
your shoulders? And if she had any pain, that could be indicative of what I'm doing is stressing the bicipital tendon, and that if she had pain, that could be could mean that she has a bicep tendonitis or labrum shoulder tear. The next test is called the Neers test, where I'm going to place my hand on the scapula. I'm going to raise her arm, pronate her arm, and raise it. If she was having any pain, that could be impingement or rotator cuff disorder, which no pain. The next test will be the Hawkins test, where I'm going to have her raise her arm, flex the elbow, and then I'm going to over-rotate her shoulder and kind of bringing the elbow back and press on the shoulder to over-rotate the shoulder. And again, if she had any pain or discomfort, that would be indicative of a rotator cuff injury as well. The next is the drop arm sign, where I'll have her raise her arms up and have her slowly lower them. And if at any point either arm just drops, if she couldn't hold it up and if it just drops, that also could be rotator cuff damage. Next, I'm going to test her hips. I'm going to have her lay down and do what we call a straight leg raise test, which it tests basically for sciatica or herniated disc. So I would have her, this is the affected leg, left leg. I would have her raise it, and if she had pain at less than 45 degrees, when her leg was raised less than 45 degrees, if she had pain, that could indicate sciatica or a herniated disc. Another test we could perform is the cross straight leg test, where I would have her raise the unaffected leg, raise it up. And do you have any pain on the affected leg?
No.
And if she had pain in the affected leg, that also would indicate herniated disc or sciatica. Next, I'm going to be looking at her knees. I'm going to stress test the varus and valgus nerve. So I think I'll come on the other side. I'm going to kneel down because it's hard to bend over. So I'm going to basically do what we call varus. The first is the varus test, where I'm going to place my hand on the medial part of her knee and my other hand on the lateral aspect of her ankle, and I'm just going to kind of do extra pressure, provide kind of opposing pressure, where I'm pushing in on the ankle, pressing out on the knee, to see if there's any pain on the lateral aspect of the knee, and that could indicate a meniscal tear. Then I'm going to do the valgus test, which is basically the opposite, where I place my hand on the lateral aspect of the knee, hand on the medial aspect of the ankle, and do the same thing, kind of doing opposite pressure to see if there's any injury to the medial aspect of the knee. Then we're going to test the ACL and PCL. Those injuries are common if some young kids who are athletes come in with knee pain. We would do tests to check to see if there's any pain or injury to those areas. The first test is the ACL, where I'm going to do the drawer sign. I'm going to sit on her, have her bend her knee, sit on her foot just so her leg is not moving when I perform this test. I'm going to take my hands, place it behind the knee or the fossa, place my thumbs on the condyles of the tibia and fibula, And I'm just going to kind of open them, kind of pressure outward anteriorly to, like I'm opening a drawer, to see if there's any pain. And then for the posterior, I would do same hands in the same position and just push inside toward like I'm closing a drawer. And that would, if she had any pain with either one of those tests, those could be indicative of ACL or PCL injury. The next test is the Lachman's test, where I'm going to have her, gotta kneel down again, extend the leg. I'm going to put my hand on the distal femur, hand on the tibia and fibia, and just kind of apply pressure to see if there's any give in that area or any pain, which she doesn't seem to have. Next, I'm going to do the medial meniscal test. I'm gonna put my hand over the knee, under the knee, place my other hand on her heel, and I'm just going to kind of internally and externally rotate the leg to see if there's any pain in the knee. And then I'm going to, with valgus pressure with my hand on the medial aspect of the knee, the outside of the knee, have her rotate the knee, and then extend it and place it down and straighten it up. Should not hear any cracking or popping, and the patient should not have any pain in that area. Next, I'm going to have her sit down, and I'm going to check for knee effusion, any fluid on the knee. I got to get on my knees, my back hurts. It's called the allotment test, where I'm just going to find the patella and just tap on it to see, tap quickly to see if there's any fluid displaced laterally. Excuse me. Next, we're going to do the balloon test, where I'm going to, from the superior pouch of the knee, just milk down to the patella, and then press laterally and see if any fluid is displaced to the medial aspect. And then I can also tap either side to see if any fluid, to see the fluid wave test, to see if there's any fluid that is present in the knee. And the final test is the patellar femoral syndrome. We're just going to manipulate the patella from side to side. It should move smoothly, should not be any pain. It should be mobile and easy to move. And, one more test is I'm going to compress the patella against the femur and have the patient kind of strengthen or tighten her quad muscle, and the patella should track into place, which it does, and there should be no pain, crepitus, or hear any crunching sound. And that is the end of my exams. Thank you.